Hello, this is Dr. Behnam. I'm a board-certified dermatologist, laser and skin cancer specialist. I practice in the beautiful Santa Monica, California, and welcome to our educational videos. Today we're going to be talking about scabies. Scabies is a mite that is transferred from one patient to another patient. The typical areas that harbor the scabies mite is nursing homes. And what happens is when somebody goes and visits a loved one in a nursing home and they have the scabies, they just transfer to that visitor. And the visitor goes home and transfers it to everybody else in the household. The clinical presentation of scabies is that it is intensely itching. It's a very persistent, non-stopping itch. Typically happens on the chest, basically the back, the arms, the hands, as well as the lower extremities, as well as even on the groin area. It very rarely affects the face, and it's an unstoppable itch. So when a patient comes into the clinic, I check the hands, and the key is to look at the webs between the fingers, and you see these linear lines, linear furrows, and those are the areas where the scabies might typically live. And then patients also have excoriations and these lesions around the breast area, on the genital area, as well as classically along the waist. And when you look at them clinically, they just cannot stop itching. They also will tell you in the story that somebody else in the family is itching as well, either their husband or wife or one of their kids. So what we do in our clinic is that we scrape it. We do some scraping from the web, sometimes the genital area, sometimes around the breast area. And we look at it under microscopes to confirm it. And you could actually either see the scabies mite under the microscope, and sometimes, it's alive. Or you could see some of, their eggs. And if that's the case, so then you treat the patient for scabies. The most common treatment is elamite, which is called permethrin. They apply the cream from neck all the way down, and they apply it overnight. They sleep with it. They get up in the morning, wash the body, and in 1 week, again, they repeat the whole thing. I also give my patients sometimes antihistamine pills, as well as topical steroids, so that to reduce the itch. Most of the time, this regimen will take care of the scabies. However, there's some patients that it is so severe that topical creams will not help. Then, in those cases, you have to try an oral medication known as ivermectin. It's a one-time shot. Basically, they take the pill one time and basically it kills the bug. It is very, very important that you have to wash everything in the house. The couches you don't have to wash. The reason is because the mite basically lives on your body. So the mite is not going to survive on the couch. Things that you can't wash, you could actually put in a plastic bag and then just put it out for about a week, and that will kill all the mites that are there. There's a form of scabies, basically, which is known as a nodular scabies, where a patient will present with nodules typically around the scrotum area. With these lesions, even after the scabies resolve, some of these nodules could certainly persist. We could certainly inject them with some steroids to make those nodules go down. One of the problems with scabies is that the itch could sometimes basically persist for weeks to months later. That is perfectly okay. It doesn't mean that a patient is still infectious. So you have to see a dermatologist to determine whether if the infection has completely gone away or not. Again, this is Dr. Behnam. I'm a board-certified dermatologist, laser and skin cancer specialist. Please watch our other videos on our website, santamonicaskin.com. If you have any questions, you can also feel free to email us or call us at our office in Santa Monica, 310-315-4989. Have a beautiful day.